Okay, so this video is going to be about preeclampsia. So preeclampsia is a concern for a lot of pregnant people. Generally, when you come in to see the midwife, you're going to have some initial labs done. So it's going to be a urine test as well as a blood test. And when you're early on in pregnancy, preeclampsia really isn't a concern yet. But it does give you a baseline on what these lab values are, such as your complete blood count, your platelet levels, just kind of a general obstetric screening. When you continue with the prenatal visits, you'll go ahead and do like vital signs, including blood pressure. When you hit that third trimester, one of the indications of preeclampsia is an elevated blood pressure, okay? If you're continuing to do urine screening in the clinic, you can look at like a dipstick, for example. Like if you're doing dipstick urine tests in clinic, one of the things to look for is the protein panel. So if it's +1, it means that protein's in the urine. Protein shouldn't be in the urine if you have healthy kidneys. So that is an indication that you're going to want to do further testing. The labs prefer a 24-hour urine catch. So to do this, you would have your client collect their urine for 24 hours, keep it either on ice in a bucket in the bathroom, or if they're comfortable with it, throw it in the fridge. After you get 24 hours of urine collected, you would send that to the lab. If it has 300 milligrams of protein in there in a day, that's too much. So that is indicative of toxemia or preeclampsia. You can also check platelet levels. If they are dropping, that could be a really bad sign of a HELLP syndrome, because that kind of anemia means that your blood cells are being attacked. So we definitely don't want to see that. There's some other things you can do, like there's kind of like a marker where you can measure the creatine level to the protein level. You can check liver enzymes. Those are also indications for preeclampsia. So let's see what the whole question is. Discuss the test and the results that might result in positive diagnosis of preeclampsia. Yeah, so your warning signs are going to be high blood pressure. You're going to want to look at liver enzymes. You're going to want to look how the other kidneys are functioning. 24-hour urine catch you're going to want to do, and the blood tests. Severe preeclampsia, you're going to have high uric acid. You're going to have proteinuria. You're going to have a high red blood count, and reduced plasma volume or like platelet levels. So those are all big things. Some symptoms that you can also warn your clients about is if they start having blurred vision, a severe headache that just doesn't resolve with Tylenol or medication. Those are definitely things you want to look out for.